Today I'd like to share 10 tips to help foster a positive clinical learning environment. My name is Lauren Cochran. I'm a pediatrician and the Director of Clinical Faculty Development here at CUNY School of Medicine. Tip number 1, how we start off with a new learner is so important. I know we could easily spend an hour or more on this one topic, but for now, I'll suggest just a few specifics to think about. First, have you oriented yourself to what's expected for this student? For example, did the school or rotation director send you any materials you might want to look over? This may or may not be your role, but think about anything the student may need to know in advance, such as what time to arrive, what to wear, or where to park. Once a student arrives, make sure they know the basics, like where's the bathroom, where should they store their belongings, including food, where can they obtain appropriate PPE. Of course, you'll want to review the clinical schedule and any expected tasks, such as whether students should be doing any documentation for their patients. And finally, remember to make this expectation setting bi-directional by asking your student about their background and what they hope to accomplish during their time with you. Tip number 2 is to make an effort to learn your student's name on day 1, including correct pronunciation, any preferred nickname, and pronouns. If a particular name seems like it might be harder to remember, you can write it down phonetically or even record a quick voice memo for your reference. And I really like this quote from a MedEd portal publication that illustrates why it matters. At their foundation, names are a reflection of identity. Names often have meaning to an individual and are frequently associated with a racial, ethnic, cultural, or religious group. The mispronunciation of names can undermine one's identity, similar to misgendering. Chronic mispronunciation can lead to feeling marginalized, not accepted or included, and undervalued, and can be experienced as a microaggression. Tip 3, after we've made sure we know our student's name and pronouns, introduce them to everyone they'll be working with, including patients. It makes such a big difference to tell a patient, Mr. X, I'd like you to meet medical student Jessica Smith, who's working with me today, versus an aside like, oh, this is my student. Tip number 4 is to consider our physical space for learning. For example, does your student have a place to sit during clinic visits or during conferences? Do you need to pull in an extra chair? Do you need to advocate with your department chair to get a couple extra computers on wheels for your ED section? Or as we mentioned earlier, is there a safe place for students to store their belongings where you work? Tip 5 is to role model humility. Well, how do I actually do this? One easy way is simply to acknowledge when we do not know the answer. I liked this quote from the Journal of Pediatrics. A teacher's willingness to admit ignorance is a powerful way to model openness to lifelong learning and build a safe learning environment for everyone. So this could be, that's a great question. I'm not sure. Let's look it up together. Or, it's been a while since I've had a patient with X diagnosis. I feel rusty on the management guidelines. Let's call Dr. Y to discuss. Tip 6 is to role model humanism in medicine. Again, easier said than done, but a concept that has really stuck with me, I actually saw this on TikTok, is seeking opportunities to commit micro-progressions, in contrast with microaggressions, or another variation would be micro-affirmations. For example, we could gently correct the use of inappropriate language. We could help advocate for a patient, even something small like calling a pharmacy on their behalf. Or we could actively affirm another person's emotional reaction to something that happened in the workplace. Tip 7 is to allow appropriate autonomy for your student. It can be quite demoralizing to have worked really hard on developing new clinical skills and then basically be told to stand in the corner and observe all day long. And I'll add a plug here for our separate Shadowing 2.0 video that reviews some strategies for giving your student a more active learning experience, even when you're dealing with time or space constraints. We're in the home stretch with tip number 8, which is to finesse your feedback. Again, I know this is a giant topic, but for now I'll just mention one acronym that I made up called the 3 O's. Feedback for your student should be given one-on-one whenever possible. We should focus on observable behaviors rather than making judgments about the person or assumptions about intent. I really like the phrase, I noticed that. For example, I noticed that you've been arriving about 10 minutes late for clinic each day. And lastly, we can deliver constructive feedback with a focus on opportunities for improvement, such as, for your next patient, can I make a few suggestions? Tip 9 is quite simple. Request feedback from your students. This simple act goes a long way to show that you're really invested in your learners and the learning environment. And our last tip, bear in mind that individuals can experience the same learning environment quite differently depending on their background. For example, I pulled a quote here from a 2023 paper in the journal Teaching and Learning in Medicine. They looked at how students from backgrounds underrepresented in medicine, URM, perceive the medical school learning environment compared to their non-URM peers. Another concern about speaking up among URM students was that they did not want to risk being wrong in a public space. And one participant said, I have more to prove because people assume that you got here because you met a quota. So just something to keep in mind, that we're never going to know exactly what someone else is thinking or going through unless we ask. So again, here are the tips. Here are my references, and thank you very much for tuning in.